The waiting is the worst enemy of patients who are waiting to get a medical intervention.
Patients from disadvantaged neighborhoods face a higher risk of dying within 30 days after elective surgery than those in wealthier areas, according to a study of more than 1 million patients in Ontario. And sociologist Sandy Torres says there's no reason to believe the situation would be any different in Quebec, starting with environmental factors.
Vous allez peut-être vivre à proximité de...
You might be living close to major highways, busy boulevards, or near factories or old industrial sites, which means you're exposed to noise and pollutants. All of that has a big impact on health. You also tend to have fewer green spaces and more heat islands. It all adds up. The study, published in medical journal JAMA, notes that even with improvements in perioperative care, nearly 2% of patients die within 30 days after surgery, a figure that has not changed over the past decade. Those from the most disadvantaged neighborhoods face a 52% higher risk of death than patients in wealthier areas. And while Canada has a universal healthcare system where cost shouldn't be a barrier, other social factors still affect access to planned surgeries.
Vous avez peut-être un double emploi.
Maybe you're working 2 jobs, juggling split shifts, or you don't know from week to week what your schedule will be. That kind of employment insecurity means you're not starting from the same place as people with stable, better paid work. In a statement sent to City News, Quebec's health ministry said from 2019 to 2021, the most socioeconomically disadvantaged group had 222.3 more premature deaths per 100,000 than the most advantaged group. The ministry added that support and resources need to be adjusted based on people's needs through a proportionate universalism approach, noting this approach is at the heart of the National Health Prevention Strategy, which aims to reduce premature mortality gaps linked to socioeconomic inequalities by 10%.
As my brother founded the association 51 years ago, he always told us, be aware, be more preoccupied of those people who don't have family, who are not visited, who are left alone in their apartment or room in a long-term facility. We need to see after them because they're the most vulnerable.
In Montreal, Johanie Bouffard, City News.